Historical background and evolution of AIIMS in India. Post-independence healthcare scenario in India. After gaining independence in 1947, India faced enormous challenges in rebuilding its social and economic institutions, and healthcare was one of the most critical areas requiring urgent attention. The country suffered from a shortage of trained doctors, inadequate hospitals, limited research facilities, and a lack of institutions capable of handling complex medical cases. Most advanced medical education and specialization opportunities were concentrated in a few urban centers, and many Indian doctors had to travel abroad for higher studies and exposure. This dependence highlighted the urgent need for a national-level medical institution that could train doctors, promote research, and provide advanced healthcare within India itself. It was in this context that the idea of creating a premier medical institute was born, an institution that would not merely fill gaps but set new standards for the entire nation. Vision behind the establishment of AIIMS. The vision of AIIMS was closely aligned with India's broader nation-building goals. The country's leadership believed that healthcare excellence was essential for economic growth, social justice, and national self-reliance. Inspired by leading global medical institutions, Indian policymakers envisioned a center that would integrate medical education, research, and patient care at the highest level. This vision materialized with the establishment of the All India Institute of Medical Sciences, New Delhi in 1956, through an Act of Parliament. The institute was conceived not as a conventional medical college, but as a national benchmark institution that would influence medical standards across the country for decades to come. AIIMS New Delhi. The flagship institution, AIIMS New Delhi, became the foundation stone of India's modern medical education system. From its inception, it was granted a high degree of academic and administrative autonomy, allowing it to innovate in curriculum design, research priorities, and clinical practices. The institute attracted some of the finest medical minds in the country and abroad, creating a culture of excellence, discipline, and inquiry. Over time, AIIMS New Delhi evolved into a super-specialty tertiary care center, handling some of the most complex and rare medical cases in the country. It also emerged as a leader in medical research, contributing significantly to disease management protocols, public health initiatives, and medical policy formulation in India. Need for expansion beyond New Delhi. While AIIMS New Delhi achieved remarkable success, it soon became evident that a single institution could not meet the healthcare and educational needs of a vast and diverse country like India. Regional disparities in healthcare infrastructure were stark, with many states lacking access to advanced medical facilities and specialist care. Patients from across the country traveled long distances to New Delhi, overburdening the hospital and creating access challenges. This situation highlighted the need to replicate the AIIMS model across different regions, ensuring equitable access to high-quality healthcare and medical education nationwide. Government initiatives and the AIIMS expansion plan to address regional imbalances. The Government of India launched initiatives to establish AIIMS-like institutions in various states. The goal was to create centers of excellence in underserved regions, strengthen local healthcare systems, and reduce the pressure on AIIMS New Delhi. This expansion was not merely about increasing the number of medical colleges. Each new AIIMS was planned as a comprehensive institution with a medical college, a multi-specialty hospital, research laboratories, nursing, and allied health science programs. By adopting this holistic approach, the government ensured that new AIIMS campuses would replicate the core philosophy of the flagship institute. Growth of the AIIMS network across India. Over the years, multiple AIIMS campuses were established across different states, marking a significant milestone in India's healthcare evolution. These institutions brought advanced medical education and tertiary care services closer to people in regions that previously lacked such facilities. Each new AIIMS contributed to training local medical talent, improving regional healthcare outcomes, creating employment and academic opportunities, supporting state and national public health programs. Although newer AIIMS campuses initially faced challenges related to infrastructure development, staffing, and patient load, they gradually evolved into important healthcare hubs serving their respective regions. Evolution of academic and clinical standards. As AIIMS expanded, maintaining uniform standards across all campuses became a key priority. The evolution of AIIMS involved continuous refinement of academic curricula, clinical training methods, and research frameworks. National-level entrance examinations ensured merit-based admissions, while standardized teaching guidelines preserved academic excellence. At the same time, AIIMS institutions adapted to emerging medical advancements such as minimally invasive surgery, digital diagnostics, telemedicine, and evidence-based clinical practices. This ability to evolve with changing medical science has been a defining characteristic of the AIIMS system. Challenges in the evolution journey. The evolution of AIIMS was not without challenges. Rapid expansion demanded significant investment in infrastructure, faculty recruitment, and administrative coordination. Balancing autonomy with uniformity across institutions required careful governance. Additionally, newer AIIMS campuses had to build reputation, research culture, and patient trust from the ground up. Despite these challenges, the long-term vision of decentralizing excellence gradually began to yield results, strengthening India's healthcare capacity at both regional and national levels. AIIMS as a symbol of India's medical progress. Historically, AIIMS represents India's transition from dependence on external medical systems to self-reliance in healthcare excellence. It symbolizes the country's confidence in building institutions that can compete globally while addressing domestic health challenges. From a single institute in New Delhi to a nationwide network, the evolution of AIIMS reflects India's commitment to inclusive growth, scientific advancement, and social responsibility in healthcare. In summary, the historical background and evolution of AIIMS illustrate a carefully planned journey, from a visionary idea in post-independence India to a powerful national healthcare network. Understanding this evolution is crucial to appreciating the role AIIMS plays today and its potential to shape the future of medical education and healthcare delivery in India.